It's my feel-good breakfast show.
Now, while the rest of the country is safely behind closed doors, South Africa's COVID-19 heroes are at the front line. However, concerns have been raised about doctors, nurses and other healthcare professionals who are risking their lives while treating those infected with the coronavirus. Dr. David Goldschagg, who's currently working in the eye of the COVID-19 storm at Tygerberg Hospital, joins us this morning to talk about how the threat is not just physical, but also takes a heavy mental toll. Dr. Goldschagg, thanks so much for joining us.
Good morning. Thank you for having me.
So give us a bit of perspective and tell us what life has been like at the moment as a doctor in the eye of the storm working at Tygerberg Hospital.
Okay, so first I'm going to start off with saying that I think an important part of knowing what's happening is knowing how a hospital functions. We have many different departments in the hospital. You have everything, pediatrics, orthopedics, obstetrics, etc., etc. And usually these entities function separately from each other. But now with COVID, we've seen a lot of working together, especially when it comes to the COVID tent. We have everybody from specialist consultants right down to our students, our final year students who are helping out. And there really is a sense of camaraderie in the hospital, which is excellent. It's really wonderful. So the hospital is a bit of a strange place, a bit of an unfamiliar place for a lot of us at the moment, but we are slowly but surely getting used to how it's working now.
And, I mean, as physicians, spending time with your patients and thoroughly examining them is an essential part of the job. So how have you managed to compensate, given the regulations to social distance and, you know, everything that we've got to deal with in this new normal, rethinking the way that you practice medicine in the time of COVID-19?
Yeah, so you would imagine that the physical interaction would have changed for us, but actually, because it's such an essential part of our jobs, it's so important to keep doing it. You have to keep touching patients. You have to keep your hands working all the time as a doctor, and also as a nurse, as anybody really working in the hospital. So what has changed and what we have had to rethink really is the PPE, the personal protective equipment that we are using now.
Yeah.
It's become the new normal to have a mask. You've got to wear a mask anywhere you go in the hospital now. Obviously, we used to wear them when it was necessary if you were dealing with a highly infectious patient, such as a TB, or if you were doing any theatres or any procedures that needed to be sterile. But now, in some wards, you're even required to wear a visor all the time. Essentially, it's turned us all into germaphobes. We were obviously washing our hands long before this to prevent cross-contamination between patients.
Yeah.
But now, in every ward, in every single room, we are using the alcohol-based hand sanitizers and the liquid soaps, and we are washing our hands probably definitely between every patient, but maybe every like 10 minutes throughout the day, which is a lot of hand washing.
Yeah, I imagine that must result in an immense strain on your mental capacity to absorb everything and to process all the information that you've got to work with. And so from that point of view, are there facilities of a psychological nature and services of a psychological nature that have been provided to the health fraternity to help cope with the toll on your mental health?
Look, the threat of COVID is a very, very real one, especially when you're working with these patients day in and day out. And the whole hospital is a place where it's obviously a breeding ground for any infection, really. So being exposed to these things is quite scary, especially for medical practitioners and just anybody working in the hospital, really. I've had a lot of friends, a lot of colleagues who have tested positive for COVID. Some of them are at home now, busy recovering. The vast majority of them have recovered and have made full recoveries and are back at work having tested COVID negative. As far as the mental health goes, I think that COVID has created a very interesting shift, putting mental health in the global spotlight now. A lot of us stigmatize mental health, but now hopefully from this some good will come of it, and especially medical people will maybe seek more help and try to find some sort of solace in their own profession.
I think for a lot of people, it might not be very easy to imagine what you guys as the healthcare professionals have to go through because every day when you go to work, you are putting yourself at direct risk of infection. So I guess the question that I want to know is, from a personal point of view, how are you dealing with that? How do you counsel yourself, motivate yourself to keep on going, knowing that you are putting yourself and essentially those closest to you at risk? But I mean, it is what you want to do, what your life's mission is.
Look, if I'm honest with you, Katlego, I've almost resigned myself to the fact that at some point I am going to get COVID. I'm luckily a low-risk person. I'm young, I'm healthy, but that doesn't by any means mean that I will be fine. I have no idea. If I get the disease, I have no idea how my body will respond to it. It's just the same as we don't for anybody, really.
Yeah.
So it is definitely a very scary threat. And we know that COVID does not discriminate. It doesn't matter who you are, what you look like, how much money you have. It can come for anybody. From my side, I've already been tested twice. Luckily, both of those tests have been negative. So I haven't had to miss any work, and I've been carrying on. One of the most important things that we can do at the moment is follow the instructions that we're being given. And we all work together to prevent that from happening.
Yeah, I guess lastly, I mean, with all that you've said, just to kind of re-emphasize why it is so important right now to stay at home and to social distance now more than ever, and even for those who might not be, quote unquote, high risk.
Yeah. So as you say now, those people who are not high risk, and I include myself in that, we are actually some of the most dangerous people in terms of the disease precisely because we might have a mild course of disease or be asymptomatic carriers. At the moment, estimates are putting asymptomatic carriers at about 50% of patients. And that's quite a scary thing, because then you might think, okay, cool, if I'm not going to have a very big problem with my body and how I respond to COVID, then why don't I just go out there and live my life? A pandemic is not an individual problem. It's a problem for the population. So you don't know how you respond, and you don't know how the next person will respond. Your behavior affects those around you. And I would really hate to get the disease myself and be completely fine, but pass it on to my neighbor who maybe didn't come out so fine. And that's why it's so important to stay at home, to wash your hands, to social distance if you need to go out, and to wear your masks.
Well, absolutely important message there. Thank you very much, Dr. Goldschagg.
Thanks, guys.
And of course, a big thank you to the thousands of healthcare workers who are on the front line every single day to make sure that communities have the medical care that we need in this time to curb the impact of the COVID-19 outbreak. These workers are holding our communities together right now. So wherever you can, in whatever manner that you can, do tell them thank you.